Discussing CT scans is heart center cardiologist Dr. Daniel O'Day. Dr. O'Day, what is a CT scan of the heart?
A CT of the heart is a way for us non-invasively, and that means without having to put catheters in your body, to take a look at both the arteries that feed your heart as well as the heart structure itself to look for any abnormalities of the heart. In general, with most patients, we can get pictures of the coronary arteries that rival those that they can get in the cardiac catheterization laboratory so that we can diagnose whether or not you have any blockages in the arteries or not. We also sometimes use the test to look for congenital heart disease or abnormalities of the way the heart is put together. This test is very good for looking at that.
Who should get a CT scan?
In general, patients who are at low or intermediate risk of heart disease, who have intermediate probability or not quite sure probability stress tests of whether or not they have heart disease, patients that have some atypical pains that are not typical for coronary artery disease, those patients are candidates for a CT of the heart. There are some caveats, however. If you're a very large person, over 300 pounds, those people sometimes don't get the best images, and perhaps a better test might be the invasive cardiac catheterization for you.
How is a CT scan different from a stress test or a catheterization?
A cardiac CT is an anatomic test. It looks at your anatomy. It's not a functional test. It's not looking at whether or not your heart tissue is getting enough blood. All we're looking at are the pipes or the plumbing of the heart, as well as the anatomic makeup of the heart. In a stress test, we put your heart under stress and see if the blood flow matches or is adequate to take care of the stress and keep the heart healthy. In an anatomic test such as a CT, we're purely looking at whether or not there is any blockages in the arteries that could lead to an abnormal stress test. A stress test has a false positive rate of around 15% and a false negative rate of around 15%. What that means is that even if you have disease, or significant disease even, it can miss you about 15% of the time. An anatomic test has a very, very much higher sensitivity and specificity in ability to find blockages.
What is actually done during a CT scan?
The CT test is very simple. What we're going to do is before you have the CTA, we will do a blood test on you to make sure that your kidney function is normal and you can tolerate the dye. After that, when you come to the test in the morning, we will put an intravenous line into your arm, very similar to if you went into the hospital for any kind of testing or if you came to the office and had a stress test even. After that, you'll be placed on the CT table, which is a comfortable table with a pillow, and then you'll go partially into a tube. It's not like an MRI where you're completely enveloped. There's open areas, and even people with claustrophobia generally tolerate this fairly well. We then take a couple of scout pictures to make sure that you're lined up, and then we inject some dye in your arm. We time that dye so that it gets to the heart at the same time we turn on the machine and take the pictures. We would like the heart to have the dye in it and be lit up at the time we take the pictures. After that, it's about 15 seconds worth of pictures and you're done.